It's Monday, May 23rd, 2022. I'm Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Today, we're going to look at an article entitled Ozone Therapy in Two Geriatric Male Dogs with Poor Vascularized Chronic Wounds. Comes to us from Romania and was introduced into the Romanian Journal of Veterinary Medicine in 2020. Our thanks to Dr. Kalin for his work on this. So we're going to look at case reports, and I think it's going to be interesting. After an unsatisfactory antibiotic treatment, the patients were infiltrated subcutaneously with ozone in a 15 microgram per milliliter dose, 0.5 to 1 milliliter point of inoculation at a distance of about 3 centimeters between points, followed by a topic treatment with 50 microgram per milliliter of ozone with the plastic bag method in one of the cases. So one case, they just did ozone gas injections. In the other case, they did some ozone gas injections along with limb bagging. So let's look at the two cases. Ozone therapy is a successful method used in the treatment of wounds that tend to heal abnormally, like diabetic ulcers, distal limb wounds in horses, high surface extended lesions, which are difficult to be protected by dressings, which tend to be exposed to infections and wounds that do not heal by conventional therapies because of maybe antibiotic resistance. Ozone in precise doses acts like a local antiseptic, tissue oxygenating agent, and epithelialization promoter by accelerating the release of many growth factors. And they go into a little bit of detail on that. We're not going to really look at that, but let's take a look at the cases. So here's something of interest. Even under antimicrobial treatment, the wound in case 1 had an unsatisfactory evolution. The contraction phase was delayed and the ischemic and necrotic process advanced. Ozone was used topically and by perilesional and intralesional infiltrations. So there's a couple pictures. They show the gangrene in case 2 and the after the debridement. So they did antibiotic treatment for 10 days on one, I believe, and 15 days on the other. To accelerate the entire process, we decided to introduce ozone therapy by local perilesional infiltrations at a 12 microgram per milliliter dose and in 1 milliliter volumes at each of the infiltration points, 3 centimeters distance between the points. So the dose or the concentration, they keep fairly low in these because it seems to do better. It seems to be better tolerated as well. Complete epithelialization was achieved after 16 days of treatment. Now, this is the one that had 15 days of antibiotic treatment with really unsatisfactory results. 6 sessions of topic treatment and infiltrations. So here's wound evolution for the second one. This is the neck area, you'll see. So from this all the way to here to F in, I think it was 46 days, ozone therapy seems to accelerate the granulization process of muscular cutaneous defects, a fact that can be macroscopically observed by a quick leveling of the deeper wounds. The concentration or contraction phase is also accelerated due to the significant reduction of the wound surface, even after a few treatment sessions. So they expedited the healing process from 1.25 to 10 centimeters squared daily. Significant evolution there. Case 1 was treated 15 days without satisfying results with antibiotics. The ozone treatment led to complete healing in 16 days. That's pretty incredible. The evolution of the two cases after ozone treatment was satisfactory. The wound had a very good epithelialization rhythm. We consider that the perilesional ozone infiltration is a great method of stimulating the granulization and contraction phase of chronic wounds, and the topical plastic bag technique is a good technique for infected atonic wounds like case 1. So keep that in mind as veterinarians when you're doing this. Not only can you do limb bagging, you can actually do peri or intralesional ozone injections, maybe about 10 to 15 micrograms per milliliter, 1 ml per injection point. There you have it. This has been 5 Minutes of Proof. I look forward to seeing you